Lung cancer is the leading cause of cancer deaths in the United States. It takes more lives each year than breast, colon, and prostate cancers combined. Surprisingly, some people with advanced lung cancer don't receive cancer care because they think there's no hope. Lung cancer doesn't have to be hopeless. Joining us is Dr. Praveen Chenna, who specializes in pulmonary diseases, including lung cancer, along with lung cancer survivor Don Stranathan. Welcome to the Morning Blend, both of you.
Great, thank you.
Thanks for being here. I think we're gonna break down the three most important things once you're diagnosed in just a second. But first, from the doctor, I want to know a little bit more about what the signs and symptoms are of lung cancer, because I think so often, as we see in all of the statistics, lung cancer isn't diagnosed until it's stage 4.
That's right. The symptoms and signs that someone can present with is cough, shortness of breath, chest pain, sometimes weight loss. But just like you had mentioned, what's alarming is most patients don't present with symptoms until advanced stage. And so that's part of the reason why I've teamed up with Genentech today to bring awareness to lung cancer and Lung Cancer Awareness Month.
Most people who associate lung cancer associate it with tobacco use, but there are other ways. Some people who've never smoked get lung cancer. What are some of the things that maybe cause lung cancer? Is there a genetic component as well?
Sure. So along with tobacco exposure, we know environmental exposures, and we're learning more about genetic and mutations that happen, and those are all factors that are playing into causation of lung cancer.
We mentioned the fact that a lot of people don't get cancer care if they're diagnosed. Why is that?
So I think one is there's a stigma associated with lung cancer. When patients hear or someone finds out they have lung cancer, they feel, one, that it's their fault, and two, that there's no hope. For years, and still to this day, we are finding cancer at a very late stage. And our goal, one of the goals in our community, is to diagnose these earlier so we can give them more options and more hope, and that is what's happening.
Don, let's talk to you a little bit and about your cancer journey. How did you find out that you had lung cancer, and what were the three most important things you did when you were diagnosed?
When I found out I had lung cancer, I was doing volunteer work in an institution in California, and I was asked to go in for a routine chest x-ray for tuberculosis. And my pulmonologist called me and said that they had found a suspicious spot on my left lung. So they continued to follow it, and then shortly after that, through some other procedures, they found a tumor inside my bronchus tube that had it 90% blocked. So my pulmonologist referred me to radiation. I had 15 treatments to have that tumor shrunk down so that an oncologist could perform chemotherapy and Avastin. And then after that, I was put on an oral medication, Tarceva. But I think some of the critical components are early detection. That people get checked for, especially if they're high risk. Second opinions. And reaching out for therapy. So many people don't reach out for treatment because of this, like Dr. Chenna mentioned, is the stigma attached. It's devastating to hear you have cancer, but then to hear you have lung cancer, that carries a stigma of shame and blame. And I brought this on myself. A lot of people just don't search out treatment, and usually, like Dr. Chenna said, it's diagnosed in the final stages, so people feel hopeless.
And Don had mentioned, treatment options. I think it's important to understand that talk to your doctor about those options as well as the side effects, because we know that all medications have both benefits and risks.
I think it's an important message of hope that both of you shared today, that regardless of what stage that you're diagnosed in, that there are options. Thank you so much for joining us.